Hey, it's Nick Fogelson from Northwest Endometriosis and Pelvic Surgery in Portland, Oregon. I wanted to record a little series of videos about questions I often get about hysterectomy because they come up so often, and there's a lot of some of them are recurrent and sort of show maybe a little bit of a misunderstanding about a variety of things, and I thought it would be kind of interesting. So I'm going to do a bunch of these. The first one I want to tackle is kind of like the big Megillah, which is, does a hysterectomy treat endometriosis? And the answer to that is no. And like, there's nothing that is absolute in treatment of pelvic pain, and anybody that gives you an absolute answer to something like this is true in all cases is probably not being very thoughtful. So when I see a patient, what I care about is their symptoms and what can I do to try to help them with their symptoms. It helps me to know what do I think is causing the pain, to know what is the best treatment. So does a hysterectomy treat endometriosis directly? The answer is no, absolutely not. You cannot remove endometriosis by removing the uterus. The endometriosis exists out in the pelvis. It exists on the surface of the pelvic peritoneum. It exists on the surface of the bladder sometimes. It can exist on the surface of the bowel or invading the bowel, all kinds of places. It also can exist on the surface of the uterus as well. And then you have something called adenomyosis, which is kind of like endometriosis within the walls of the uterus. So endometriosis specifically cannot be treated by removing the uterus. And that is sort of a mythological beast that a lot of kind of general gynecologists, particularly older surgeons and gynecologists, kind of believed you could remove the uterus and treat endometriosis. And that leads to this situation where someone may have really bad endometriosis and they just go in and they kind of pluck the uterus out from amongst all this endometriosis. And shockingly, the patient does not get better. Not shockingly, it is obvious they will not get better. They will stop bleeding, and to whatever extent the inflammation that is caused by the menstrual cycle is contributing to the pain, then they will see some improvement from removing the uterus. But if you remove the uterus and you don't remove all the endometriosis, they're going to get a very incomplete resolution of whatever the problem is. That they may find that it is somewhat better, but they will not be a lot better. And so you can't just remove the uterus to treat endometriosis. You have to remove the endometriosis. So hysterectomy doesn't treat endometriosis. So, but does that mean that you should never have a hysterectomy if you have endometriosis? No, not at all. I mean, there are plenty of patients who have endometriosis, who have done childbearing, who have uterine source pain, and they may also have adenomyosis, which is really best treated by hysterectomy. So if you're having endometriosis surgery, having a hysterectomy is often a very good thing to do. And I don't want people to go down this road of, well, hysterectomy doesn't treat endometriosis, therefore I shouldn't have a hysterectomy. What you should do is find a surgeon who's very experienced with management of pelvic pain of all kinds of sources, have them assess your case, whether that's me or another skilled practitioner, and then if they recommend a hysterectomy, take that under consideration and maybe you have a hysterectomy. But I wouldn't have the hysterectomy alone. I would also remove whatever endometriosis is present. So don't not have a hysterectomy out of spite of people saying that hysterectomy treats endometriosis. Have a hysterectomy if it's appropriate to do. Just don't think it's about the endometriosis. It may just be an additional thing. So that's the first thought. The next thing I'm going to talk about on the next video is, does a hysterectomy prevent recurrence of endometriosis after endometriosis surgery? That's a big question I got, and we'll shoot for that one next time.